Today I want to talk about something really sad and important for Dachshund owners, IVDD or intervertebral disc disease. My very fit 6-year-old sadly needed an emergency surgery. This happened 5 weeks ago and she has made huge improvements and is able to walk again. This is the only reason why I'm releasing the video footage. Obviously this has been really heartbreaking, but I'm positive she will make a full recovery. If you have a Dachshund, you've probably heard about IVDD. It can affect any dog, but sausage dogs and French bulldogs are predisposed. So in this video, I will break down what IVDD is, the 5 grades and how vets diagnose it. I will include how she was prior to the surgery and the first week of her recovery. In future videos, I will do weekly updates so you can see the progress and the physio exercises we did to help her recovery. Foxy is a fighter and she really showed how determination and a positive outlook helped her get better. So while I explain what IVDD is, here's some footage of her before the surgery. She began at grade 2 and progressed to grade 4. As it was a Sunday, it is only possible to get a CT scan if they are grade 3 or higher. While we waited for the CT scan, she received pain meds and conservative treatment. If this had happened on a weekday, she would have received the CT scan much earlier and would not have to wait. Amy was always by her side and tried to comfort her. I am a vet myself, so I was able to do much of the treatment at home where she felt more comfortable. Okay, so IVDD stands for intervertebral disc disease. To understand it, you need to know a bit about your dog's spine. The spine is made up of bones called vertebrae that run from the skull to the tail. Between each vertebrae is a soft cushion called the intervertebral disc. These discs are like shock absorbers, letting your dog move and bend comfortably. In dogs with IVDD, these discs become brittle and can rupture or herniate. When this happens, the disc material shifts out of place and presses on the spinal cord. This pressure restricts the signals between the brain and the body, which affects movement. This is shown in the CT scan. Dachshunds are especially prone to this because of their long backs and short legs. The shape puts extra stress on the spine. Let's talk about the 5 grades of IVDD. Vets use a grading system to assess how severe IVDD is in a dog. The grades go from 1 to 5, with grade 1 being the mildest and grade 5 being the most severe. Grade 1, mild pain. At grade 1, the dog is in pain but can still walk normally. They may move slightly, hold their head lower, or be reluctant to turn their heads or jump. The pain usually focuses on the mid to lower back. Most grade 1 cases can be managed with strict cage rest and pain medication. The disc rupture often self-corrects within a few days. Foxy had a bit of mild backache a month before but made a full recovery, so I thought. She was on strict rest and carried in a rucksack on walks for some weeks. Her reflexes were always normal. She got an infusion initially, pain meds and a course of acupuncture, and after 2 weeks she was back to her usual self. Grade 2, moderate to severe pain with coordination issues. At grade 2, the dog can still walk but struggles with coordination. You might notice them knuckling their paws, swaying, or having trouble with stairs or jumping into furniture. The pain is more intense than grade 1. About half of grade 2 cases respond well to conservative treatment with rest and medication. The other half may need surgery if they don't improve. Grade 3, partial paralysis. At grade 3, the dogs can still move their legs but can't stand or walk on their own. They might drag one or more paws or need support to stay upright. Surgery is usually recommended at this stage. The success rate for surgery at grade 3 is close to 100%, while conservative treatment has about a 50% success rate. This is what Foxy had on the Sunday 5 weeks ago. This then sadly progressed to grade 4 within a few hours. Grade 4, paralysis with deep pain sensation. At grade 4, the dog is paralyzed and can't walk, but they can still feel deep pain in their feet. Vets test this by pinching the toes. If the dog reacts, they still have deep pain sensation. Dogs at this stage often can't control the bladder or bowels. Surgery has about a 90% success rate at this stage, but timing is critical. Most vets recommend immediate surgery, As it was out of hours and a Sunday, it was not easy to find a clinic that could do a CT scan and have a surgeon operate. Luckily, I was able to find a good one who was willing to come in on a Sunday. For completeness, I will mention grade 5. Grade 5, complete paralysis with no deep pain sensation. Grade 5 is the most severe stage. The dog is completely paralyzed and has lost all deep pain sensation in their feet. So pinching the toes will have no effect and the dog is not able to feel it. If they can't feel their toes being pinched, they won't be able to walk or bear weight on their back legs. They're not able to go to the toilet by themselves and their bladder has to be manually expressed. Surgery at this stage has about a 50% success rate and should ideally be performed within the first 24 hours. This is considered an emergency situation. Foxy's condition was progressively getting worse, and I definitely did not want her to become a grade 5 case. It's worth noting that conservative treatment can be effective for severe grades, though surgery still offers the best chance for recovery in grades 3 to 5. We will now talk about how IVDD is diagnosed. If you suspect your dog might have IVDD, the first step is to visit your vet. They'll do a complete physical and neurological exam to assess the dog's condition and determine which grade they fall into. But to confirm IVDD and see exactly where the problem is, imaging is needed. There are several options. This includes X-rays. Plain X-rays can show bone positioning and disc calcification, but they can't show spinal cord compression. So while X-rays are useful for ruling out other issues like fractures, they're not enough on their own to diagnose disc herniation. When Foxy had her initial back pain 4 weeks ago, we did plain X-rays, and there was a slight narrowing of the last thoracic vertebrae. MRI is considered the gold standard for diagnosing IVDD. It provides incredibly detailed cross-sectional images of the spinal cord and discs. The downside, MRI is not always readily available and are more expensive. Your dog will need to be referred to a specialist. CT scans or computed tomography are faster and less expensive than MRI. For most breeds with mineralized or herniated discs, CT is highly effective and can often be done under anesthesia by most orthopedic clinics. Treatment depends on the grade and how quickly your dog is deteriorating. For grades 1 and 2, conservative treatment is usually tried first. This means strict crate rest for several weeks, anti-inflammatory medications, pain relief, and sometimes muscle relaxants. The goal is to let the disc heal on its own while preventing further injury. For grades 3 to 5, surgery is recommended because it gives a better chance of recovery. The most common procedures are hemilaminectomy for herniation in the back or a ventral slot for herniations in the neck. Foxy had the hemilaminectomy at T12, T13. After surgery, recovery can take weeks to months. Rehabilitation and physical therapy can really help with recovery. Some dogs bounce back quickly, others take longer, and some may have residual issues like wobbliness or incontinence. This is Foxy the morning after the surgery. She was still a bit high on the pain medication and we kept her on a drip for another day. We ensured she was comfy and warm and she obviously had to be cage rested. You can't completely prevent IVDD since it's partly genetic, but you can reduce the risk. Keep your dog at a healthy weight to reduce stress on the spine. Minimize jumping on and off furniture or going up and down stairs excessively. Use ramps or steps instead. Avoid activities that involve twisting or high impact like leaping for toys. It is also important that your dog has regular exercise so the muscles are well developed. IVDD is scary, but knowing the signs and acting quickly makes a huge difference. If your Dachshund shows any signs of back pain, trouble walking, or changes in behavior, get them to a vet right away. Early treatment, whether conservative or surgical, gives your dog the best chance at recovery. On day 3 after surgery, Foxy was already wanting to move. Foxy loves food and she was always waiting for her next meal and ready to eat. Here we began easy physio exercises. Our main goal is to have her weight bearing her back legs, so I used a sling to hold her up. Then we did lots of passive motion exercises where I just moved her back legs. This is also to prevent muscle wastage. The trick is to do small amounts often. I never did more than 2 minutes at a time initially. I set up a puppy pen so she was not able to crawl around and rest. I fed her on a raised platform which made it easy for her, and ideally she should have a non-slip bed. I ordered plenty of carpets and laid out non-slip beds and pads as the wooden floor is really hard for her to get a grip on. By day 2 she was continent. She needed help to get her in position to go to the toilet, but she was able to control the timing. This was really promising, and I was really happy for Foxy as she is a really clean dog, and she was mortified when she lost control of her bowels. Here I used a rolled up blanket as a sling. She seemed to know it was helping her. You can see how arched her back is. This needs months of treatment to correct. Here I am supporting her to stand, moving her back legs in a walking motion and shifting her weight from her front legs to her back legs as well as side to side. This will help her improve her balance and help start the nerves from firing again. On day 4 post-surgery, I could see Foxy was trying to move her tail, especially when wanting to go to the toilet. She tried to do the squatting but would lose her balance and do her business in motion. I used her baby harness and lead to hold her back legs up to. Amy was always by her side, giving moral support. On the 4th day, Amy slept next to Foxy for the first time since her back injury. I took this as a good sign. On day 5 post-surgery, Foxy showed signs of sadness about a paralysis for the first time. She wanted to go on the sofa as this was her favorite place to be. Unfortunately, I could not risk her falling off, so she was complaining about that. I felt bad, but she needed to stay safe. Here she lifted her bum a little bit off the ground as she was dragging herself along. This was an improvement. She also felt better as she was giving me her puppy dog eyes to get on the sofa. We also started her hydrotherapy. This made a huge difference to her progress. Obviously, I couldn't allow her sutures to get wet, but the hip-high water helped her stand. I could tell this made her feel so much better. I did 3 short rounds and would move her legs in a passive motion. I would try to stimulate her feet and nerves. At work, I put her in a crate to prevent her from moving too much. She was quite happy in this. Amy would always check on her or even go in herself to cuddle. I left the door open as Foxy was not able to get out anyway. I bought an anti-slip bath mat for the hydrotherapy. This had more grip so it was easier for Foxy to stand on. She became more confident standing in the water, and this would also help prevent muscle wastage. Foxy is able to drag herself around the living room. There's a very slight movement in her left back leg. She's determined to make it up to the sofa but is not able to. This is the only thing that seems to bother her. At day 6 post-op, Foxy was able to stand by herself in the water. I was so excited for her. You can see in her face how happy she was. Amy was always crying to get in, but she hates water. I finally put her in and she was not impressed. That was the last time she asked to join in bath time. Foxy got an anti-inflammatory painkiller and a tablet to treat neuropathic pain. Taking them in her food was no problem at all. It was time for a rest and the girls snuggled up together. A week after the spinal surgery, Foxy was standing more sure-footed. She still needed to be supported or else she would fall over, but she was able to hold her balance better every day. I was trying to get her to take a few steps with treats so I could correct the back legs. I used treats, but it didn't really work as Foxy is so food motivated and would then just sprint off dragging her back legs, which was not the purpose of the exercise. Foxy was completely continent from day 4 post-surgery, and she would also ask to go outside. Day 7 was the first time the girls played, but it was too much for Foxy and she cried out. Amy was really respectful and would be really gentle with her from then onwards. The yoga pillow I had ordered had just arrived. This was an alternative to the sling. I placed the pillow between her legs and I was able to do the exercises much easier. I introduced a new exercise where the front legs were raised. This is to improve her balance and coordination. In this session of hydrotherapy, Foxy was wanting to take a few steps in the bathtub. I was helping her back legs move. I wanted her nerves to fire and build her muscle memory. I placed treats at the end of the tub and this motivated her even more. If you found this helpful, give it a thumbs up and let me know in the comments if you have experience with IVDD. And as always, take care of your sausage dogs. In the coming videos, we will show you the recovery. It has been a learning curve and we were trying to figure out how to practice the physio exercises to best suit Foxy. Luckily, she's a fast learner and loves to do treks, so she saw physio as learning. See you in the next video.